Hi, I'm Dr. Johnny, and today I'm showing the insulin syringe technique for under eye fillers. Everyone wants to know about under eyes. Here's another technique to look at. So today, let's look at filling the under eye with the needle technique. Now, we would use a cannula the majority of time. Sometimes we need to get a little bit deeper and lift the lower layers up off the periosteum, the bone. We're pretty much always under, or we try and be with a cannula underneath the orbicularis oculi. We want to avoid using a needle as much as possible. The safe plane is going to be the periosteal plane, and we want to inject slowly. The under eye has many different layers. It's complex. It's bone loss, it's fat loss, it's the lid cheek margin at the lower palpebral eyelid that we're trying to fill. So not everyone's the same, and having these different techniques in your toolbox is key. And we've talked about the cannula technique, adding PRF, doing PRF first. Here I'm showing you where we backfill an insulin syringe, and in this case a 0.5 ml with a 31 gauge. What I'm doing, of course, we cleanse and we pre-ice, and then I'm injecting on the periosteal level. So just kissing the bone layer, because this fine needle will get dull very quickly. So we only add 0.1 to 0.2 mLs per syringe, inject down on the bone. You can see my injection cadence is very slow, watching for blanching, watching for any discoloration, and watching the patient. If the patient's having unusual pain, often means we're near a nerve, and the vessels go along with the nerves. It lifts the tissue up off the periosteum nicely, and it ensures we're at the deeper layers below the orbicularis oculi, especially in those patients that don't have a lot of facial fat. So I combine those techniques very commonly. I start with the cannula, but I will use that technique, and that's how you do it. You want to use a product, of course, that doesn't draw a lot of water in. Thanks for joining me today. We love to hear how you do it. If you're a patient, what's your experience with under eye filling? You can comment below. Subscribe to the YouTube channel. Also join us on Facebook and Instagram for continued helpful tips. Keep your skin and body beautiful, healthy, and vibrant.